Good evening, dear friends. So, many people are interested in the question, how do you hang correctly on the pull-up bar to straighten your back? Of course, no one has any doubt that hanging on a pull-up bar is extremely beneficial for your spine. Because if you feel the urge to stretch out, you should satisfy it right away, because under the influence of gravity, our spine is constantly subjected to and experiences compression, which needs to be stretched out regularly. You should constantly stretch your spine because it's very beneficial. You aren't the only one who thinks this way. These thoughts don't come to mind because of a lack of intelligence or narrow-mindedness. Even many doctors in the early 2000s and late 1990s thought that way. Back when there were many different spinal traction procedures, there were special traction tables for that. It was during that time that I began my honorable professional career, and I was observing how these spinal traction procedures were being introduced into neurology and manual therapy, and I saw the outstanding results of these treatment methods. And today I will tell you about them, and we will discuss and find out how to stretch something without making things worse. And it's better if things actually get better too. So, friends, look here, we have a frontal view of your spine. Let's say we're looking from the back or from the front. It doesn't matter. These are the vertebral bodies, the vertebrae. Let's say this is the lumbar region, and these are the intervertebral discs. And here we can see this kind of curve of the spine to the side, a bit of a tilt like this, right? Just like in the picture here. And the peak of this curve is located in the area of this intervertebral disc. And here is what the disc itself consists of. As many have guessed, it includes the nucleus pulposus inner disc and annulus fibrosus outer disc. A hernia, what is it? It's when this nucleus pulposus comes out. It comes out from somewhere. The annulus fibrosus tore. So this outer shell of the disc either tears or becomes loose and fibrous, basically also tearing, and then this inner part of the disc comes out. But actually a protrusion, if we speak correctly, all of this is a hernia, both protrusion, prolapse, extrusion, and there's also what's called a sequestered hernia. But actually in real life it would be so that in everyday language, basically, it's common to say that a hernia is when the fibrous ring has already torn. But in fact, that's actually extrusion or prolapse, and protrusion is when this fibrous ring hasn't torn yet. It's just a bulging, for example, to one side or another. So the nucleus pulposus itself hasn't come out yet, but it's kind of shifting to one side and the disc bulges out a bit. Why is it dangerous? It can compress the nerve roots that pass nearby. In short, it compresses the nerves. It either causes pain or impairs motor functions, depending on which nerve is compressed. And if the spinal cord is compressed, there will be even more problems. And in this case, there's an interesting process happening right here. Here, as we can see, the pressure is applied from top to bottom onto the disc, like this. So it's kind of being compressed. Here, we see that it's being compressed. But what happens here? Here, the distance between these vertebrae increases, and on the contrary, the fibers of the disc are being stretched. What was the idea back then? Magnetic resonance imaging had just started to appear. It was only in the early 2000s that we began seeing all these herniated discs. Before that, hernias weren't a thing. No one seemed to have any issues. No magnetic resonance imaging, no hernias, hardly any surgeries either. Something would hurt for a bit and then it would go away. But the leg stopped moving, and if you're lucky, it started moving again. No one had seen magnetic resonance imaging, didn't even know what it was. Then magnetic resonance imaging appeared, and suddenly everyone had hernia. Everyone started treating them. So, friends, they saw this mess right away. There was a desire to stretch something here, to pull something so that all of this would straighten out. But as it turned out, what do you think, by the way, where would a hernia appear? On which side? Here or over here? The hernia, as it turned out, appeared not here in most cases, but over here. Because the fibers of the disc were tearing, they would rupture and the nucleus pulposus would come out here. Right here. It wouldn't go here, but here, like this. And all the stretching procedures that were supposed to stretch the disc like this, well, not the disc, but something. Ask those who did this, what exactly were they trying to stretch? They wanted to increase the distance here, but what actually happened was that it pulled here and the disc tore even more. The hernias got bigger. That happened, but not in every case. Of course, there were some positive cases among those who were luckier. What is dangerous about this traction procedure itself? The danger is that you can't precisely choose the spot where the stretching will occur. It's impossible to position a person or set the angle in such a way that the stretching happens exactly where it's needed. Because the spine itself is a complex structure, so the stretching will happen where it's already stretched. And in all these things, in all these procedures where you stretch something, this specifically applies to the spine. Most often it will stretch on that side if you pull along the axis like this. If you hang a crooked person like this, if we take him and hang him and start stretching him, ideally it should be stretching here, but it will actually stretch here in this spot where the muscle is weaker. Because with this kind of impact, if we start pulling in different directions, reflex muscle tension will occur, and on the side where they are more developed, it will be stronger, and the stretching will happen on the opposite side. So what should we do? How should we proceed? The thing is, see das Divovich curve? We need to keep in mind that the structure of the human body is more complex than the structure of an earthworm. In what cases would stretching help? If you were just like an earthworm, or see das Divovich curve. For example, a worm, like a pinworm. If we were like roundworms, pinworms, or at least caterpillars, then indeed, all these procedures would actually help us. We would hang ourselves like this on a pull-up bar. Here's the bar, hang there and straighten out. We would feel very good, quite energetic. But the structure of our body, unfortunately, is more complicated. There are different angles of movement. The biomechanics of a worm are not the same as the biomechanics of a human, unfortunately. That's why we don't get the same therapeutic effect from hanging on a horizontal bar as a worm does. So, what should we do? How should we proceed? It's a difficult, complicated process. You can't just stretch us out like that. You have to. If you really need to stretch each shortened muscle, stretch them separately. So, what can you stretch safely? The viewer, already nervous, will ask. He or she can't sit still on the chair. They're spilling tea and saying, "What are you telling us all this for? What are you going on about? Come on, show us faster." 15 minutes of chatter and only one exercise shown at the end. Skip to that part. Write in the comments at what minute the exercises start. There are special people who mark this kind of thing. So, look, this time we're focusing on the lower back. On the sides, on both sides, there is the majestic iliopsoas muscle, which tirelessly supports your spine. Here it is next to the worm. See, right here. It stabilizes and holds your spine. Despite your unhealthy lifestyle, it does its job every day. But in this case, what do we see? This bend has appeared, this curvature, on the side where we have it. In short, we have this kind of arc. And what should we be looking at for reference? Here we have the pelvic wings, right here. Here we have the sacrum. So fifth, fourth, third, second. That's schematically, since there are 5. Here we have the 12th rib, and here it is higher, right here. The distance is greater here. Here the distance is smaller between the 12th rib and the iliac bone. On the side where the muscle is weaker, the distance is greater. On the side where the muscle is more shortened, the distance is smaller. All right, look, I won't be lazy. Here it is again. Oops, where did it go? I won't be lazy. Look, I'll show you this schematically one more time. Now on a whole person, not just the lower back. We'll go over it together. It's already a more or less complete human body. Look, here we have the pelvis. Here it is pleasing to the eye, and I'm drawing the exact same curve, exactly the same. See how it is there. This is the same person we have here. Do you recognize him? And here it is right here. There, the 12th rib. Who came from it? That was Eve, the first woman on planet Earth. She came from the rib here, and there is the 12th rib on the other side. You see, Eve didn't come from this one. It remained free. And here are the other ribs. They are not as important. The 11th, the 10th, no one came from them. We won't even draw them separately. We'll just mark them as the rib cage like this, just generally. So what do we have here now? The iliopsoas muscle. Here it is, the right one. It will also be shorter than the left one. The left one will turn out to be longer. And the quadratus lumborum muscle. The right one is also shortened. The left one is longer. If we take this person now and hang him on a pull-up bar or lay him on a traction table, what is our initial idea? We wanted to help him with this. We wanted to stretch all of this out for him, but it won't work. It will stretch here, making him even more crooked. That's why you need to stretch these two muscles separately and train this area here. How do you do that? You can do it with just one exercise. Can you imagine? You don't even need to leave the couch. Who's relaxing on the couch or watching from bed right now? You're really lucky. Then just turn onto your side. If you were lying on your back like this, let's say you were chilling, just turn onto your side just like this. Make this kind of turn. Which side? That's the problem. Which side should you turn to? So how do you determine which side the muscle is shortened and which side it's longer? Of course, you can determine it by your bony landmarks. If they're not covered by too much fat, you'll be able to do it. Here is the 12th. No, it's not the 12th rib anymore. The 12th rib is in the back. Which one is this? This is the costal arch, and this appears to be the 10th rib. Here is the cartilaginous part, likely still the 10th rib. Right here, you can feel its front part on yourself. And the second landmark is the anterior superior iliac spine. But let's at least try it this way. Let's not complicate things. Let's not assume that you have different leg lengths. Let's first look at the distance between the anterior superior iliac spine and the front part of the 10th rib and measure this distance on the right and on the left. Measure and see the difference between them. On the side where the quadratus lumborum and the iliopsoas are shorter, this distance will be smaller, and on the other side it might be larger. There. That's the first way you can determine the difference. The second way is by observing the movement of the ribs during breathing. On the side where everything is more tense, mobility will be worse. And now you can take a breath, inhale. Here you'll need to undress to take a look. You can't see how the ribs move under the clothes. Take a breath in. And it might look like this. Look, here on the left side, right here, there's more movement during inhalation. And on the right, it's the opposite. During exhalation, the ribs contract better. There, on the side where the muscles are less developed, inhalation will be better, but exhalation will be poor. And on the opposite side, it's the other way around. Insufficient inhalation and very good exhalation. But, friends, if you still have doubts, what should you do? Nothing bad will happen. Most likely, if you do this exercise on both sides, who knows, maybe nothing bad will happen. The only thing is, maybe when stretching already stretched muscles, if there is a hernia, it could get bigger, so be careful. Or maybe don't stretch at first, but just do the first part of this exercise to strengthen the muscle. That would be better. Itata. So, if you're not sure, don't do the stretching part. Just do the strengthening part. Ita. Watch what you need to do. You take a position lying on your side. In this case, I am going on my left side. Here you go. I lay down successfully. I stretch out my legs, both legs at once, just like that. They stretch out together. And now I'm lifting them off the floor. Don't hesitate to hold on with your hand right here. There. I lift them off the floor and try to keep my legs in line with my torso. But also, look, here's one way to determine which side has a better developed muscle and which side is weaker. Try doing this exercise on one side. This is good old static. You hold it on one side like this, using your muscles, and time it in seconds or in minutes, hours. That depends on how advanced you are in these static exercises. It will probably be seconds or milliseconds for some. How long can you hold your legs like this? But for the average accountant, it will be somewhere from 5 seconds to 20 seconds. Hold it. For this exercise, 10 to 20 seconds is enough. 2 or 3 sets. There you go. Hold it to one side. Everything here tenses really well. And then you can turn to the other side and try this movement. This exercise on the opposite side. You lift it up just like that. The most important thing is to keep your legs in line with your torso so they don't move too far forward. And hold it in this position. There you go. And you can feel it. Sometimes both sides don't work well. Sometimes one side works better than the other. They won't lift too high. It's enough just to raise them off the ground once. That's good enough. But if you support yourself with your hand, you can go a little higher. This is the first part of the exercise. Basically, it's suitable for everyone. If you do it on the side that's already well developed, nothing bad will happen. But If you train the weaker side like this, it will actually get toned. And here is the second part we stretch. Here you need to decide exactly what you're going to stretch and in which direction. Let's say, for example, I've determined that the muscles on my left side are shorter. So what do? I lay down on my left side. First, I lift my legs and hold them up, then put them down, and now I lean on my arm like this and relax my back and lower back. And hold like this. Just for about 10 or 20 seconds, I lie like this. But if you start doing it the wrong way, you'll immediately feel that something's not right. There's tension, some pain, discomfort. So, if you feel that, it means you're doing it on the wrong side. Try doing it on the other side. But if everything is fine with you, you shouldn't feel any discomfort at all. Not on one side or the other. What's happening here? Here the quadratus lumborum muscle is being stretched. And how should the exercise be done? Ideally, when you know exactly which side is weaker, what can you do? You train it. For example, my left side doesn't work as well. So I lift my legs and hold them like this. I hold for 20 seconds, then lower them, and then I get up on my hand and stretch to the opposite, right side. This kind of activity is beneficial, but it requires a bit more quality work from the brain.